Hello, everyone. Thank you for joining us today for this important webinar and roundtable discussion on the legal health and equity considerations related to HIV criminalization. It's great to see so many of you joining today. My name is Ian Rick John, the Vice President of External Affairs for ChangeLab Solutions, and I will be serving as the host for the webinar today. First, I want to take a few moments to go over some logistics for the webinar. The webinar will be recorded and posted online. The chat function has been disabled, so you will not be able to chat with other participants or post comments in the chat. However, you may ask questions through the Q&A function. So please type in any questions that you have, and we will attempt to address as many as we can during our webinar today. We've already received quite a few questions from the registration information, and we will also share some links and some information possibly through the chat during our webinar. There is a live transcription option available for today's session. So in your Zoom window, you should see a button that says live transcript pictured here on the screen. And if you click on that, you'll have the option to either show or hide subtitles. And you can also adjust the font size to fit your preferences under the subtitles settings. If you do have any technical issues during the webinar, please just raise your hand and my colleague Bernard Lim can reach out to you to assist. Thank you to Bernard and our team at ChangeLab Solutions for helping us to ensure that all the technology runs smoothly for today's webinar. Before we begin, I want to remind you that the information provided in this webinar is for informational purposes only and does not constitute legal advice. ChangeLab Solutions does not enter into attorney-client relationships. You can look at the screen here and see the language. And then one more disclaimer. Today's webinar was made possible in part by a cooperative agreement with CDC and does not represent the official policies of the Department of Health and Human Services. And there's the funding disclaimer slide there. So let me just do a brief overview of our agenda for today's webinar. We will first hear some opening remarks by Dr. Rochelle Walensky, the director of the CDC. Then Sarah DeGia, CEO of ChangeLab Solutions, will provide a brief overview of the HIV criminalization legal and policy assessment tool. And after that, we'll have a panel discussion moderated by Dr. Jonathan Merman of the CDC. On this slide, you'll see our speakers and panelists for today. I'm not going to read all their names and titles. You can look on the slide here and see that we have a great group of people who will be sharing their thoughts and perspectives. Dr. Merman will have a chance to introduce the panelists later during our panel discussion portion of the webinar. And now I'm going to turn it over to Dr. Rochelle Walensky for her opening remarks.
Thank you for joining us for HIV Is Not a Crime Day and this important discussion on the legal, health, and equity considerations related to HIV criminalization. After decades of research and significant biomedical advances to treat and prevent HIV, many of the state laws passed during the early years of the epidemic are now outdated. They may have been appropriate for what we knew about HIV at the time, but now, 40 years later, they do not reflect our understanding of HIV transmission. For example, we know that a person with HIV who takes HIV medicine as prescribed stays virally suppressed or undetectable, can stay healthy, and will not transmit HIV to their sexual partners. We know that pre-exposure prophylaxis, or PrEP, reduces the risk of getting HIV from sex by about 99% and reduces the risk of getting HIV from injection drug use by at least 74%. As President Biden has said, we have to follow science, and that means eliminating the laws that perpetuate discrimination, exacerbate disparities, discourage HIV testing, and take us further away from our goal, the goal of ending the HIV epidemic. Laws and policies that do not keep pace with medical and scientific advancements, including those that criminalize conduct by people with HIV, provide little to no public health benefit and even actively cause harm. HIV criminalization laws increase stigma against people with HIV, may discourage HIV testing, and worsen existing inequities as these laws disproportionately affect people who are Black and LGBTQ. To advance health equity and to end the HIV epidemic, we must address structural barriers to HIV prevention and care, make sure laws are evidence-based and just, and that they support public health efforts. At CDC, we are committed to providing the tools and resources policymakers need to evaluate their state HIV criminalization laws and policies, so people are not discriminated against based on their HIV status. Today, I'm very excited to share a tool that CDC developed in collaboration with our partners that will assist states and policymakers to make sure their HIV laws and policies align with the most current scientific and medical evidence. CDC's HIV Criminalization Legal and Policy Assessment Tool is a vital resource that provides an objective assessment of a jurisdiction's laws, regulations, and executive orders that control HIV surveillance and prevention. This tool can also help identify opportunities to strengthen legal and policy protections for people with HIV, protections that are also likely to benefit public health more broadly by aligning them with evidence-based best practices. We look forward to continuing to work with our partners to support comprehensive legal and policy efforts to decrease stigma, reduce disparities, and support public health efforts. Again, thank you for joining us for this important conversation.
So thank you to Dr. Walensky for providing those opening words. I would now like to introduce Sarah DeGia, the CEO of ChangeLab Solutions, to provide some more details about the tool that Dr. Walensky just mentioned. I'll turn it over to Sarah.
Thanks, Ian. Thank you so much for joining us today for this timely and significant webinar. I'm Sarah DeGia, CEO of ChangeLab Solutions. And before I provide an overview of the toolkit that Dr. Walensky mentioned in her opening remarks, I would like to introduce ChangeLab Solutions to the partners of those of you who aren't familiar with us. ChangeLab Solutions is one of the many partners that contributed to the tool. We are a nonpartisan, nonprofit organization that uses the tools of law and policy to advance health equity. We partner with communities across the nation to improve health and opportunity by changing harmful laws, policies, and systems. Our interdisciplinary team work with community-based organizations, governments, and state and local institutions to design and implement equitable and practical policy solutions to complex health challenges. Next slide, please. I'd like to say thank you too to the contributors to the toolkit today. At ChangeLab Solutions, we focus our work on addressing 5 fundamental drivers of inequity: structural discrimination, income inequality and poverty, and disparities in opportunity, as well as disparities in political power and governance that limits meaningful participation. I share these drivers as context as we think about the role that laws and policies have been and could be used to discriminate against people with HIV, preventing them from living a full and healthful life. Before our panel, again, thank you to the contributors. There were so many, and I really want to take a moment to thank everyone who contributed to the toolkit. Before our panel discussion today, I would like to provide a brief overview of the content of the toolkit that has recently been released by the CDC. The toolkit is for public health professionals and partners, legal counsel, and state and local health departments to help them, 1, assess local and state laws that impact HIV surveillance and privacy, and that criminalize the conduct of people living with HIV. And 2, to identify ways to improve these existing laws and policies so that they align with evidence-based practices. Next slide, please. The toolkit is divided into 3 sections: an introduction, which includes the background on the topic of HIV criminalization and the role of data; 2, the main section, which focuses on the assessment of the legal and policy landscape in a state or local jurisdiction; and 3, a high-level overview on conducting legal research and analyzing laws and policies. Today, I'll focus on the main section of the toolkit, the legal and policy landscape. Because preventing the incarceration and marginalization of people with HIV, while ensuring public health officials have the tools to collect, use, and share HIV-related public health data, requires careful consideration of the laws and policies that are applicable to HIV surveillance, criminalization, and data privacy. Understanding, assessing, and where needed, modernizing these laws and policies is vital to addressing HIV. To help stakeholders navigate this complex landscape of laws and policies, the toolkit is divided into 4 subsections that offer key questions and considerations for assessing laws, policies, and practices. The first section deals with health data privacy, providing a general overview of the federal and state landscape of laws that apply to the confidentiality of general health information, public health data, and HIV-related data. Some of the questions presented in the tool include how disclosure is defined in a state, what data can be disclosed, how disclosure is protected and regulated, and which government entities can access which data. The next subsection focuses on general health surveillance and HIV testing laws. Content and questions in this section focus on state laws relating to testing requirements, how testing results are shared and with who is required to report HIV-specific data, and state laws related to the reporting of other communicable diseases. The next subsection focuses specifically on how states criminalize conduct related to HIV. This varies greatly state to state, and the tool provides examples of laws that criminalize conduct. In this section, questions for assessment include if there are specific HIV criminalization statutes in the state, what are the elements of those laws, and what are the penalties for violation. The final subsection focuses on implementation and enforcement. This section includes questions on how regulations are adopted to implement HIV-related laws, whether health department staff are required to receive training on data privacy and confidentiality, and how agencies collaborate on implementation and enforcement. This is just a brief overview of the content in the tool, which we hope will be a valuable resource in helping public health practitioners, policymakers, and partners involved in HIV prevention assess and improve the laws in their states and local jurisdictions. I would now like to turn it over to Dr. Jonathan Merman to facilitate our panel discussion today. Thank you.
Well, thank you very much, Sarah. I really appreciate all the work that ChangeLab and colleagues from throughout the nation and at CDC have done in terms of developing such a helpful toolkit. So today, we are going to have a panel of some, as described by Ian, of some really distinguished people who have spent a time and effort for many years working in this area. And as they load up through the correct link, I'm going to just say that I really welcome this roundtable discussion. I think HIV criminalization is an area where public health, justice, equity, and law all intersect. And for many of us, HIV has always highlighted the core of a society. Frequently, it's compassion, and often it's injustice. Not because of the virus or disease itself, but because of how communities and lawmakers and individuals view the world and respond to an epidemic. And today, I really think that this panel will highlight some of these really important issues. So we have our speakers. I'm going to introduce them. I think we are missing a couple who are going to join through the correct link soon, but we will have Harold Phillips, the director of the White House Office of National AIDS Policy, Robert Suttle, the chair of the Elizabeth Taylor AIDS Foundation Council of Justice Leaders, Brad Sears, the associate dean of public interest law and the founding executive director of the Williams Institute at the UCLA School of Law, and Vinita Gupta, the national director of the Network for Public Health Law. And we received many questions in advance from the audience, who currently is over 430. And what we're going to do is I'm going to ask one question of each of the panelists, and then we'll open it up to to questions from you. And I've already seen a few in the Q&A, but please feel free to add any as you're inspired during the discussion. And so to start off, I'm going to ask Vanita a question. And just addressing health equity and centering our community's needs is vital to repealing state HIV criminalization laws and changing our practices regarding the misapplication of general criminalization laws. So could you talk about how health equity intersects with the need to strengthen legal and policy protections for people with HIV, and how communities can create structural change by engaging in the law and policy process to benefit public health?
Thank you so much for the question. And as you know, this is such a complicated issue, and I could talk about it the whole day, but I promise I'll stay precise and short. So first of all, let me begin by applauding CDC and the partners for advancing public health-oriented approach, grounded in equity and focused on evidence-based interventions that address the underlying social determinants of health. And then a big shout out to Corey Davis, who leads Network's harm reduction work, raising awareness about syringe access policy and strategies to reduce infectious diseases transmission for people who inject drugs. So with that, I want to respond to your question. So health equity and public health, as we know, they're intertwined, right? If public health is a fabric, then health equity is the thread that makes it. It's a framework. Public health is a framework for promoting and protecting the health of the populations. And health equity is a core principle of ensuring that everyone has a fair and just opportunity to achieve good health, regardless where they live, how much they earn, who they are. And I feel like I have a firsthand experience on the both sides of the health equity in public health. As a very privileged public health physician and a lawyer working in India, to a brown immigrant woman living in US. In my early days, years of moving to US, I did not have health insurance. So I tasted the first time in my entire life how it is, how health equity is everybody's issues. The page keeps turning in our life. One time we are here on this side and the other on the other side. So it's everybody's issue. HIV affects marginalized community disproportionately. We know that. And these are the same communities that face significant barriers to accessing healthcare services and achieving optimal health outcomes. So discriminating laws and policies, they reinforce and stigmatization and the barriers instead of relying on sound and evidence-based proven public health approaches. So it's not only, it's counterproductive, right? And, the overall strengthening of legal and policy protections for people living with HIV is a critical component of efforts to promote health equity and ensuring that all individuals have access to healthcare. Now, to last point to your, how can communities create structural change by engaging with law and policy? Structural change is a multifaceted, multi-sectoral approach that puts the affected communities at the center. And unfortunately, often the affected communities are either invited to the table too late in the game or given salt and pepper when the food is already cooked and ready to go, or left out completely. So I think that communities co-leading the change is the first step at all levels, including public health and law and policy. They're the framework. Public health is a framework which health equity and public health play in. So it's crucial to have the communities co-lead it, and overall creating structural changes to benefit public health requires a coordinated and collaborative approach that involves policymakers, healthcare providers, community members, and individuals. By working together to implement, again, I will stress evidence-based policies and programs, which the tool that Sarah just described is an excellent way, one of the big tools in our toolbox to actually assess our policies, right? So the last point I would make is that communities can create structural change by engaging in law and policy process to benefit health, public health more broadly in several ways: policy development, advocacy, building partnerships, and then building the health literacy of all stakeholders. So with that, I'll pass it back to you, Jonathan.
Thank you very much, Vanita. And fortunately, our other three panelists have joined us from the West Coast. Thank you. Hello, everybody. You've been introduced in absentia. And so what we're going to do is ask each of you a question, and we also are receiving questions in the Q&A function that we're going to be able to respond to. But if it's okay, I wanted to ask Robert just a question, which is, as you know, you've been steeped in this work for many years as a leader in the movement for HIV racial justice. Could you speak to the current state of the fight to change laws and practices compared to when you started? And from your perspective, what would be the most important actions for the viewers to take today? Unfortunately, we cannot hear you. Nah, yes.
Thank you for the question, and it's really good to be here to share in this discussion today. Wow, a decade ago when I first got into this work, out of my own experience, which I first want to acknowledge the Council of Justice Leaders, because today is a day that really signifies our experience of HIV criminalization. So for those, I hope they're tuning in, but if not, just wanted to take a moment to at least acknowledge the people who've been through criminalization, who's been threatened with prosecution, because really this really is about them. And we can sit and talk and examine HIV criminalization all day long, but it's really about the people who've really been impacted. And as someone who entered into this work or this movement a decade ago out of my own experience, I found that there was not a lot of people that were aware of this issue. And so, but the community has really galvanized around decriminalization with the intention of really changing the laws and really raising awareness about the unjust practice of HIV criminalization. I didn't even know that this was such a thing until I went through it myself. And so since then, we've been able to really develop a consensus that something is not right, that this is not right. And from there, we actually were able to develop a conference, and we call it the HIV Is Not a Crime Training Academy, which will be happening later this summer. And so through that, we've been able to establish coalitions, statewide coalitions across the country in various states that have been proven to be really successful in modernization or bringing awareness in those, like I like to call them hotspot states where this is happening. And so through the conferences, we're able to bring close to 300 people every 2 years together to train, to learn about HIV criminalization and how to go back to their states to develop strategies that best represent the political reality that's going on in their state. And so, and from there, we've been able to find many opportunities to bring awareness through conferences, through webinars, through all sorts of means. Currently, we have the Health Not Prisons Collective, which are an organization of national organizations that have been longtime collaborators. You got the Positive Women's Network, you got the Cyril Project, Counter Narrative Project, you got the U.S. People Living with HIV Caucus, you also have the Transgender Law Center. And so those are 5. And so together we are committed. We've been committed to addressing this issue as a racial justice issue. And we've also been committed to the meaningful involvement of people living with HIV, because it's about us. And so therefore we should be at the forefront of all the decision making as it relates to criminalization, because we were not included in the beginning when these laws were established. And so there was the problem to begin with. And so we're fortunate that we've been able to really move the needle in terms of awareness and really bring some change in states. And we're continuing to do that even now. I mean, the repeal of the law in Illinois shows that the work what we're doing the right thing. We're on the right side of history as it relates to this, because we recognize how unjust this is. And I hope that others will commit to not only examine HIV criminalization, because the community has done that work. We have the stories, We have our Council of Justice Leaders, which represents the stories that many people currently have heard and even stories that people have not heard. Those people are involved in the movement, which they should be, and they should be at the forefront of that. But the community has really figured it out. We know what we want to see as it relates to repealing these laws or modernizing these laws. We know what we want. We just need everyone else to catch up and get involved and commit in the way that we're committing. And really, again, not examine HIV criminalization, because I think we know what it is. We know how it happens, why it happened, who it happens to. Now it's time to really commit to really undoing the things that need to be undone so that we can get rid of these laws and avoid prosecution for people now and in the future.
Thank you very much, Robert. And as the team works to reactivate the camera for the people in California, I am inspired by what you had said, which is that a lot of the reason that we've spent so much time working to change the interpretation and use of laws and repeal those specific HIV criminalization laws is because of the community. That's why we've become activated as a larger HIV community and one that believes in public health justice, because it's come up so frequently as an important issue. And I thought it would be a good time to turn to Harold Phillips and just ask you, Harold, could you speak to the Biden administration's work to address HIV criminalization laws and how it may fit with the larger administration's overall work to advance and protect LGBTQ plus rights?
Sure. Hi, Dr. Merman. Great to see you. And thank you to both ChangeLab and our colleagues at CDC for this important work. As you and Robert have talked about, sort of realizing and understanding the impact that these laws and policies have on the community and listening to the community, we realize that HIV criminalization laws and their policies increase stigma, exacerbate disparities, and discourage HIV testing, and that the state laws and practices that criminalize actions taken by people with HIV should be evidence-based. President Biden discussed this in his 2021 World AIDS Day remarks and is included as part of our national HIV/AIDS strategy, the need to modernize or repeal these outdated laws, which exist in over 35 states right now. Critical state steps to address some of these outdated laws and practices include educating members of state and local justice systems to ensure that they understand the scientific and medical data and public health goals. So I'm excited about the work that CDC has taken on and the new tool that will help do the analysis of the legal and policy landscape in many states, and also the work that ChangeLab is doing to establish HIV state training to assist 5 to 7 states apply the HIV criminalization legal and policy assessment tool, and that others can access these tools on the website as well for CDC. The other thing I think that we've done successfully within the administration is host a meeting of prosecutors from certain states, working with the Association of Prosecuting Attorneys and the Center for HIV Law and Policy, and having others, including NASDAQ and the Williams Institute, talk about the data and talk about these laws. It really helped to raise awareness in the public safety sector of these laws. Many who attended this White House gathering weren't even aware of the data or the impact that it was having. It gave them an opportunity to also really understand where we are in the HIV epidemic and movement and what it really means to transmit HIV, and the fact that spitting and biting is low to no risk at all in terms of transmission. So the other thing that I will say that we're doing, we've called for, as part of the National HIV/AIDS strategy, greater partnerships between the private sector as well. And I think, as Robert alluded to, there is a need for us to really work to ensure that there is awareness of these laws and their impacts. And there's a role for our private sector partners in that as well, both to help educate lawmakers, educate others within their states, as well as their ability to fund this work on a state and local level. So we're also looking at across sort of the federal spectrum, what else we can do to support the work that needs to happen at the state and local level as well. And we'll continue to raise awareness at the national level as part of our implementation of the strategy.
Well, thank you so much, Harold. And now I wanted to ask Brad Sears a question. You've been tracking the enforcement of HIV criminalization laws across the country. Could you share what you're seeing in states, and are there any positive or negative examples that you'd want to highlight for the audience?
Yeah, thank you, Dr. Merman, and I'm happy to. So at the Williams Institute, for the last 8 years, we've been doing a series of studies looking at how these laws are actually enforced. Who do they impact today? We know that they were passed initially in the 1980s, the early 1990s. What's happening on the ground today? I think if you'd asked me and any number of people kind of active on this issue in 2015 about the enforcement of these laws, we probably would have said they're not enforced that often. And when they are, it's about non-disclosure in sexual relationships or non-disclosure in needle sharing, because that was making newspaper stories, if there were any stories. We did our first study in 2015 in California, and we found that that was not at all the case. While the cases that were reported by courts and the media had reported maybe a dozen to a couple of dozen cases at that time, there'd actually been 800 arrests under California's HIV criminal statutes. And from there, we've now done about a dozen states looking at enforcement patterns. And I definitely just want to echo something that Robert said. This really is a racial justice issue. What the enforcement patterns show that these crimes are really about race, not risk. And what I mean by that is that they amplify the disparate impact that our criminal legal system already has on people of color. They do not follow any sort of pattern that would be rational in terms of people who are putting people at risk are the ones who are arrested or prosecuted. And I'll just spend a couple minutes walking through that. I think our first main finding is these crimes are not rarely enforced. They're very frequently enforced. In every state we've looked at, we first look at the court records, the media records. Usually it's a couple dozen or less in a lot of states. By the time we get the statewide enforcement data, and then sometimes local data, we document hundreds of cases of enforcement in every state we've looked at. From Tennessee and Missouri to Virginia, Kentucky, the numbers are always in the hundreds, so a lot more enforcement. Second, you would expect, as we learn more about HIV, that the enforcement rates would decline. That's not at all true. In fact, in a number of states, the states have added to their HIV criminal laws in the last 5 to 10 years, leading to more prosecutions recently than in the beginning of the epidemic. That's particularly true with the addition of new crimes focused on spitting and biting related to corrections officers and law enforcement. So you mentioned that, just not a way that you can transmit HIV, but there's newer legislation actually focused on those areas. The third kind of major finding is that this is not all about risk. If you look at the letter of the laws that are being enforced, about 95% of the arrests occur under laws that don't require intent. They do not require conduct that it could actually transmit the virus, and they definitely don't require transmission. And when we look at actual case files about what happened, and I'll get to an example in that second, we see the same thing. These laws really aren't enforcing, the enforcement patterns aren't explainable by higher or lesser degrees of risk based on contact. As I said, spitting and biting is kind of one of the most frequent areas that we see with prosecutions. So who's bearing the brunt of these laws today? It's primarily people of color, disproportionately women, and disproportionately sex workers. So, for example, in the first state that we looked at, California, I mentioned that there were 800 arrests. 95% of those were against sex workers. So that's actually who was bearing the brunt of the criminal enforcement. In the states that have a special crime or sentence enhancement for sex workers, that hasn't invariably been true, that we see the over-enforcement against sex workers. People of color, as I mentioned, and in particular Black people, are also bearing the brunt of enforcement of HIV criminal laws. I come from Missouri. About 5 to 6% of the state population is Black men in Missouri. They make up 35% of people living with HIV. They make up over half of the people arrested for HIV crime and close to 60% of the people convicted for an HIV crime. So a huge disproportion in who the disease impacts, but then you add a criminal legal system that also disproportionately impacts Black and brown people, and you get one result. The final thing, and I think offers some hope. So you said kind of, you asked me kind of where's some hope in here, is a lot of the statewide patterns of enforcement are driven by local jurisdictions. So there's a bad story there in that some police departments, our counties or prosecutors, get a hold of these crimes and they tend to really over-enforce. So going back to Missouri, just under half of people living with HIV in the state of Missouri live in the St. Louis area, but that area is responsible for about 60% of HIV arrests. Where I'm from in Kansas City, about 30% of people living with HIV live in the Kansas City metropolitan area. They're responsible for only about 10% of HIV-related arrests. Thanks to Harold and others, I've had the chance to sit down with the district attorney in Kansas City and ask her why the difference. And she said, I'm part of the difference. When I was elected, I came in here and I said, we're going to stop this. And she changed the practice locally, which has led to a big difference in her area. So I guess the overarching message here is that really is not about risk. It primarily, the enforcement burdens people of color and consequences that can last a lifetime, including being on sex offender registries.
Thank you, Brad. I think it's really helpful to hear how much individuals matter, as well as jurisdictions and one of the questions from Michael Rosinski in our Q&A was, what specialized knowledge or training do criminal defense attorneys need to protect and advocate for their clients' interests with regard to HIV criminalization? And so I think that in one side, it's, well, how do we provide the appropriate information to the defense? And then the other side is, how do we work with the either specific legislation or prosecutors? But in this case, it's about defense attorneys. Does anyone on the panel have a thought? And Vanita, you can turn on your camera, please, and then maybe you have something to say.
Yeah, I mean, first of all, I'd say these laws need to be repealed at the state level because of the stigma that Harold and Robert mentioned, that this is a very outdated, I'm not sure it was ever appropriately dated, view of people living with HIV at the time they were passed, but definitely not today. And they need to be repealed. There are ramifications for everyone living with HIV to be criminalized in this manner. There's a lot of states that have these laws where that's going to be difficult. And I think what's hopeful is that public health officials, local law enforcement, chiefs and officers, and criminal defense attorneys and prosecutors each can play a role in reducing the impact that this actually has on people today. And so I think one thing that we found is that just training about the medical and scientific knowledge we have about HIV and what actually can transmit the virus and what cannot, and U equals U. A lot of people don't know that information. People working in this field know that information, but that's news to a lot of people in the criminal legal system. And so if we can provide that training, I think that's one of the most powerful things to change some of these practices.
And I would echo that. And perhaps that's why prosecutors are so adamant about bringing these charges or these convictions to people, because maybe they are missing that information. And honestly, the fact of them not knowing about that is no excuse if they're going to enforce HIV criminal laws. There's that type of ignorance is no excuse to continue to do the oppressive practices that they're doing. And honestly, I don't think there's enough political will within law enforcement or even certain legislators that support these racist, queer-phobic, transphobic policies there are people in position of power and influence that really aren't interested in decriminalizing this. They want to continue to, just because there's incentives, there's money to be made off the backs and bodies and the lives of people who are already marginalized. Like, we know this. And so they have no interest in really decriminalizing. But I will say that they need to get the information about such as you and in terms of the latest science, because maybe that will make them realize that this practice, long-term practice that they've been doing, has been wrong and unjust since day one.
Yeah. And I think to add to that, one of the things that we're trying to do from, as part of the work of the Biden-Harris administration is use the bully pulpit of the White House to bring attention and awareness to these issues so that we can get the change that we all need that will help us in the HIV epidemic and in the stigma and discrimination.
So I think for all of us, what is highlighted by the current situation is that law and policy are public health tools for good and for bad. And we're trying, and one of the questions that came up is really a question about, instead of kind of working on a lot of the, educating people or, changing individual behavior, what about working at the higher level and pushing for broader decriminalization laws around sex work and drug use and quality of life crimes, decreasing direct contact between law enforcement and people with HIV in key populations, and other kind of systematic changes in some of the laws. Has there been efforts to do that? And the question came from an anonymous attendee, so I can't cite their name.
Jonathan, can I go back to the previous question for a quick second, please?
Of course.
Yeah, so I think that I want to add because it's a state's law, the criminalization is state level. So it's so different there's so many different laws. So there's no one answer to that. So one thing I would say is that the defense lawyers should be very embedded into the state laws. And it's multi-sectoral issue. It's a public health issue. So not as much approaching from very singular perspective of criminal defense, but also engaging with the broader team of public health professionals to find a good defense on that. And I think that's a short-term fix. And long-term fix is also to build the capacity, literacy of the across boards. The doctors should know the law and policy that affects their patients, and lawyers should know the health and policy from public health perspective that might affect their and then similarly, judges and everybody, all the stakeholders in this decision we should aim to increase their literacy for a long-term solution. Sorry about taking you back on that question.
I just want to push back. I understand we're looking at this sort of higher level and kind of working it down. Actually, you need to start from the bottom, from the community, from the ground with the community. It's because they're the people that are actually going through it. And they know exactly what's happening to them in regards to these practices. So I just want to stress, we have the science. I heard someone say that the way to end the epidemics, because we have the science, we have the community engagement, and we have political, and also it takes political will. But what the community engagement is the part that's missing. Everyone's talking about the people that are impacted, but no one's consulting with the community, with the people that are impacted, other than just for our stories, which the stories are powerful. We need the stories, we need to know how it's happening, but we also need to be included in the decision-making and the strategies. So we need to be talking to the district attorney, we need to be talking to the prosecutors, we need to be talking to law enforcement so they understand how their practices are impacting us directly, since law enforcement and others deal with us, whether it's in the courts or in the streets or in the hospital, wherever it is. And we know best in how these actions or practices are impacting us. So why not listen to us? And again, the community is doing the work to change the laws in the states, more so than whether it's federal or even the state government. It's the community that's doing that work, that has done that work for the past decade. So I think it would behoove us to really pay attention to say, hey, I need to connect, I need to improve my community engagement so that we can help these people that we talk about bring about the change that they're seeking in their state. So I want to strongly suggest that, because obviously no one's talking about that, or we're talking about the people.
And that's how we're going to get the change that's needed in those systems, is by engaging the community and supporting the community to make those changes that are required at the state and local level. The White House has a lot of power, but the White House can't change state and local laws. We can hope to change attitudes, and we can change awareness, and we can educate others about the need for some of that change to occur. But it's the individuals that are impacted by those state and local systems that have to make those changes, and we have to figure out ways to support them in doing that work, like Robert said.
Mm-hmm.
And I think an important part of this is there are thousands of people incarcerated today because of HIV criminal law. There are thousands of people across this country today who are in sex offender registries because they talked to a plainclothes police officer a decade ago about having oral sex, which can transmit HIV, and that got them on the sex offender registry in Tennessee, and now they can't drop their kids off at school because that's prohibited because they're on the sex offender registry. And there are tens of thousands. So what our data cannot capture is the number of people who have been pressured to plead to other crimes because they were charged with an HIV crime. We have talked to prosecutors and they say HIV crimes are easy to prove. You want to, once you know the person's HIV positive, you pretty much got your case together. And so they use it to get people to plead other crimes. So it's really about repeal and relief. And it's not just repealing these laws, but how are you going to address the people who are in jail today? You need to include with that repeal getting people off of sex offender registries for something that never made sense in the first place.
Another question that came from the kind of attendees is, who or what forces are at play that oppose efforts to repeal these laws or strengthen protections? And what are barriers to achieving these goals, because they seem so sensible?
So I think this is really interesting. And so we've looked at the legislative history of these laws, and it's not surprising that some of the groups that passed them were very homophobic and kind of, very transphobic groups. And so if you look at Nevada, for example, literally the Nevada legislature makes a deal in the 1990s that they'll repeal the sodomy law of the state if the state will pass an HIV criminalization law. This is what the head of the Senate Judiciary Committee does in Nevada. Sitting before him are kind of fake researchers from Family Research Council, very kind of anti-LGBT, kind of that establishment group of people. They're testifying for against the sodomy law being repealed, for the HIV criminal law passed. So the origins of these look as bad as that. I have to say today, this is a tool of power. And so I think a lot of the resistance comes today from law enforcement. And I think in almost every state where people have worked, law enforcement shows up and has an interest in the biting and spitting laws that deal with law enforcement and first responders. And that's a big hurdle. I have to say the public health, you said public health for good and for bad. I think we've seen that in some states as well. Sometimes these laws originate in public health statutes, and we've seen resistance to changing those statutes, which I think are just about kind of institutional power and control, even though there are little to no other cases of them being enforced against any other type of a disease. And so I think that's a little surprising. It's not necessarily the kind of, far anti-LGBT right showing up at these hearings. It's law enforcement and in some cases public health.
Right. So these laws are basically protecting law enforcement when really the people that are impacted, people living with HIV, we have no protections. There are no protections in terms of our HIV status. So if it's considered criminal And if you're living with HIV, you're engaged in any type of sexual activity, and if someone accuses you of not disclosing or whatever the case may be, you're automatically criminally liable. Like, it's like we don't care if you're innocent. Well, we're going to lock you up and we'll just figure out the rest later. And I think for legislators, a lot of them feel like creating criminal laws is just going to be the answer regarding the race, the incident rates as relates to other sexually transmitted diseases. And they have to know that does not make sense. And so we know that it does not make sense, but I don't understand why people still tend to go down that road when it does not make scientific sense. And so that goes to show you that there are people in positions of influence and power that are not educated about HIV, but they definitely support criminalizing our communities. And that is not good practice. That is not good governance. And that is not a good person that should be in positions of power and influence, making decisions about people in regarding to people's lives in ways that they don't care to know or don't understand.
And I would add that on the broader perspective, that it's the same forces, the fear of the others, right? It's somewhat the same forces, whether it's brown and Black people, whether it's a marginalized LGBTQ community, or in the controlling, the will to control by, the same forces that are trying to control the reproductive health for women. So it's a similar sort of forces coming into confluence and matched with the antiquated laws we have, right? And matched with the challenge we face is that it's a state level law. So there's no cohesive sort of approach we can take towards it. So altogether, it becomes really complicated, powerful force. And the way to address is also, like mentioned before, is the community at the center. And giving them a seat at the center, again, I'll build on my point that I mentioned before, that usually, and I think, Robert, you also mentioned that community is usually brought in for stories. And I mentioned in my opening answer is that either they're brought in when food is cooked, or they're brought in as a tokenized sort of like, okay, they're here. So they need to be leading it. There's no negotiation about that if we want change, right? So I think it's all those things, it becomes a harder force to deal with. Anyway.
So another question kind of, I think, involves a little bit of empowerment of individuals, not just the system. And that's a question from Leon Golson, which is, how is intent proven in court? And I suppose the other thing is, how is disclosure proven? Are there things that in some of these environments where the risks are great, is there advice for people with HIV?
So I mean, intent, you have to have evidence of intent. I mean, lawyers like, they'll take a shot at the intent question. But the intent has to be proven with evidence. Obviously, the clearest evidence is somebody says something. And I think if you go back to like the kind of sensationalized stories of when I was, coming of age in the 1980s, those were the stories that you would see sensationalized in the paper. They were, I would think, largely mythical and exceedingly rare. But that's one way somebody directly says something. You can also show it by a pattern of behavior, but in the disclosure, obviously, you can do that orally, and I think there have been some recommendations that you can document it. I'm going to stop there because we've already moved down a path that what this is about sex, I think, and an intent around sex, and then disclosing before you have sex. And I have to say, and I feel like, you listen to me now, I probably sound different than in 2015, but I've seen this data forever, and and that's not what we're talking about. And I'm going to give two really quick examples. About 20% of the convictions for all HIV crimes in Missouri come from the St. Louis Police Department, and they follow this pattern. A Black man is arrested for resisting arrest and no other crime. That is the only charge at arrest. The either the law enforcement officers or the prosecution find out that he's HIV positive, drops that charge, which is harder to prove, and puts in the old HIV crime for sex, needle sharing, or any other conduct. And so that conduct is whatever happened at resisting arrest. And then you have a Black man in St. Louis, Missouri, who's HIV positive, who's probably going to be who probably would be experience a great deal of pressure to plea anyway, but now they're going to think about going through a jury in St. Louis, knowing the AIDS phobia and racism that they might face. And yes, they all plead to that crime. That's what it looks like. In Shelby County, which is where Memphis is, it looks like 95% of the sex work cases are arrests by a plainclothes police officers who kind of, we get the times of when they go out and make the arrest. So we know there's kind of a schedule to their activity when they're like, well, we got to do some enforcement now. We're doing it on Monday afternoon. And they go out, if they arrest someone who's not HIV positive, that becomes a misdemeanor. If find out the person's HIV positive, that becomes a felony with sex offender registration. Again, most people plead. So that's being arrested for a conversation that happened, and 47% of those conversations are only about oral sex. And so that when we think about the enforcement of HIV crime, we need to, I think, the typical case is not that sex and disclosure case. It's one of those two scenarios is driving most of the enforcement today.
And that obviously highlights how science can help, but won't solve our problems. There was a question also from Steve Holman, which I think highlights some of this kind of working at all levels advice that's been provided by the panel. But it says, so it sounds like community members can pursue both changes to HIV criminalization laws as well as changes to prosecutorial practices. How would the panel suggest approaching prosecutors on this? And does the toolkit contain advice? And do we know if it is more effective to approach prosecutors as a team with community partners? As I think people have highlighted, it's essential, but also, and is it better only as community, or is it better as a team with kind of public health leaders or political leaders, or even leaders from the legal and kind of law enforcement side?
I think it takes us all working together. I mean, each of us may have sort of our specialty with, whether you are legal minded or law enforcement minded or public health minded, whatever it is, but we all should be working together. I mean, that really is how it should be working. And of course, people living with HIV leading those efforts because they really know best how their lives are being impacted. And so it really takes all of that, all of those partners, those team working together with the same messaging, especially from their perspective or their expertise. But and community people have expertise. People living with HIV are expert matters of their own being, of their own diagnosis. So we can't discount them as if like they don't know any better because they're living with HIV or they're marginalized or whatever people's view are about them. These people, we have credibility. And so we need people to believe us and believe that. But we all need to be working together. And it's all about messaging and countering the narrative that has been out there for decades about people living with HIV or about Black people, trans people, sex workers, whoever, whatever. Those narratives need to be done away with so that people really recognize us as people. We're people first. We're not just subjected to our diagnosis.
I think that the tool, I'm sorry, go ahead.
No, you go ahead.
I was going to say, I think the tool has some great insights that can be used, but I also think that this is an opportunity for us to create and build some partnerships to address these issues. I think as we've discussed as part of the panel, it's not only a public health issue, it's a racial and social justice issue as well. And I think there is great intersection between that and a need on the public safety side of things to improve the health and well-being of the community. And so we have an opportunity to sort of look at where that intersection is between public health and public safety, using scarce resources and looking at the fact that many of these issues and the applicability of both the law and the policies are creating inequities. And so those of us who are sort of focused on equality and social justice and racial justice, as well as public health, this is an opportunity for us to come and work together on this.
It is, and I think we are forced by time to end with your comments, Harold. I really appreciate the insight from all the panelists and from the participants' questions. I'm going to turn it back to Ian John for final closeout, and I appreciate the work from Sarah and ChangeLabs in developing this toolkit, and for everyone who's been working on this really important issue for many years.
Thank you, Dr. Immerman, and thank you to all of our speakers and panelists for this really rich discussion today. Hopefully you've all enjoyed this webinar and learned something new today. I just want to briefly mention two resources to highlight on the screen. One is the actual tool, and the other is a fact sheet, a CDC fact sheet on HIV criminalization. The two links are here if you want to take a look at those. One last reminder, please complete the evaluation, which you will receive via email after the webinar. And thank you all again for joining, and enjoy the rest of your day. Bye, everyone.